Good afternoon, and welcome to our final webinar in the 2017 three-part webinar series, A Roadmap for Ethical Responses. Today's webinar, Applying Ethics, a four-step framework for sorting solutions to ethical challenges, is a continued collaboration between the Manitoba College of Social Workers and the Canadian Association of Social Workers in providing continuing education opportunities during this National Social Work Month. For those who may not have attended previous webinars in this series, my name is Fred Phelps, and I'm the Executive Director of the Canadian Association of Social Workers. And it is my privilege to once again welcome you and to introduce our presenter, Vicki Verge. Vicki is the Regional Director of Social Work for the Winnipeg Health Authority. As with previous webinars in this series, the first half of the webinar, approximately 30 minutes, a presentation by Vicki, followed by a half-hour question and answer period that I will moderate. I do ask during the presentation, you can type in questions at any time, and please do, because as her presentation winds up in a half hour, I'll begin asking questions right away and love to have a few ready to go. Please note that the recording of this webcast, as well as Vicki's PowerPoint, will be made available on the CSW website in the near future. And now, for the final time in 2017 on this ethics series, it is my pleasure to welcome Vicki to present to the over 700 people registered for this webinar today. Thank you very much, and take it away, Vicki.
Welcome, everybody. Thank you, Fred. So, today is going to be an overview of a four-step framework for ethical decision-making. This tool is not meant to be a step-by-step process, and not every section is going to apply in every situation. It is meant to just be a resource, a tool, or a guide to help social workers and their teams have effective conversations to find ethical resolutions to difficult problems. I'm going to walk through the model that you see in front of you. It's a 35-page framework that can be found online at the Manitoba Provincial Health Ethics Network, or Manitoba PHEN. The tool was designed by the Manitoba PHEN organization and WRHA Ethics Services by adapting and combining a number of frameworks from across Canada. Although it is recognized that social workers provide work in a variety of contexts, this framework should be applicable in any context, whether that's clinical or even non-clinical. Sometimes trying to determine what should be done can be very challenging. This is where ethics, a systemic method for exploring options, can be of use. Using an ethics-informed process can help determine which choice might be better and provides an objective basis for explaining our decisions to others. Research has demonstrated that the quality of decision-making improves with the use of ethical frameworks, and it can lead to improvement in decisions. This tool does not need to be followed in any order, but for today's purposes, I'm going to present it as a four-step model. It is possible that not everyone will agree to a chosen solution, and this framework will not necessarily tell you an answer. The model will help you and your stakeholders work through key issues so that they can at least support the final proposal. This model is meant to be a collaborative tool. So why use a framework? Ethics, as we talked about in Module 1 and 2, is really concerned with morals and values. Behaving ethically requires us to think about questions such as what is right, what is wrong, what do I think and why do I think it, what is important in this particular situation. Ethics is not one part of our life, but rather a way of looking at life. As we encounter life's challenges, whether they're big ones or little ones, we need to ask these types of questions. Of course, we can't settle all or even any of those questions quickly. The conversations we have and the tools we use to help us make decisions help us work through these questions systematically. So the framework is intended to help people have effective conversations and to find ethical options to difficult problems. The framework helps determine what should be done or could be done. This is where ethics, as I've said, is a systemic method for reviewing options, can be of use. An ethics-informed process helps us determine which is a better option, and most importantly, it provides a basis for explaining our decisions to others. I've included into the webinar here today, or in this module, a bit of an overview of an algorithm. Sometimes trying to decide whether or not something is an ethical issue or not is also hard to do. So when an ethic issue arises, we all look for ways to help solve it. If you have an ethical situation, this algorithm may help you identify next steps or the most appropriate place to get help with your situation. It's been approved by the Manitoba Fen Council. So really, if you think of a clinical situation, perhaps some kind of conflict has been identified either by the family, a staff member. Your opportunity is to first sit down and think about what is the conflict and to describe the nature of the problem. And if you look at the algorithm, you can see it gives you a variety of kind of potential outcomes. Is this a communication problem? Are our values at conflict? That's what you kind of see on the left-hand side. On the right-hand side, is there some kind of therapeutic failure, personality conflicts? If you think that it's more on the left-hand side, that there's some values conflict, or there's a true dilemma between what options might be right, good, bad, wrong, or you're not really sure, this is where you might see an ethical issue emerging. What we're going to talk about is kind of who some of your stakeholders could be, but really at this point, it would be an appropriate step for staff, social workers, to go and consult with a trusted colleague, their supervisor, and see if that might just solve the issue. If it doesn't solve the issue, you might want to then move into using this ethical framework that I'm going to suggest today. So, one of the first steps in this ethical framework, if you think about the model that I showed you on step 2, I'm just going to go back here and show you the overview. I'm going to work through this circle. So the very first step is this number 1, clarifying the problem. So clarifying the problem. My favorite 2 questions to ask anybody is, how do you know there is a problem? And what are you worried about? So if staff come into me, if they are using the ethics algorithm that we just talked about, and they come in and they say to me, there is a problem, I often try to ask them, what are they worried about? And this is really the first stage of any kind of ethical, working through any kind of ethical issue. What led you to feel this way? What are the facts? Write them down. Sort out for yourself what are the facts and what information might be missing. Sometimes we're told something and we think that's a fact, but it's really important at this very first step to really outline what is the main problem. Analyze your biases. As we've discussed in earlier modules, we all have biases. We all have different values, different beliefs. So what are yours? What are your gut instincts or what are your gut feelings about this particular situation? Are you making any assumptions? And what is your role in this situation? What are your expectations? And what goals do you already have about this particular problem? Do you already have a solution sorted out? The third part of this is really clarifying the question again. And I know that might seem redundant, but now that you've kind of thought about the dilemma in front of you and your own position about it, think about it a little bit further. Is there still conflict? What is the nature of that conflict? What is the problem that needs to be solved? Sometimes when you first come in and you outline a problem, you think it's a big problem, and then once you collect a little bit more information and think about it, it can be really pared down to something specific. Revisit the facts at this stage and make sure you have all the information you need. The last part of this first step is really considering the stakeholders. So who's going to be affected by your decisions? If you think of systems theory or person environment, which is our social work background, we know that decisions we make all occur within a complex set of relationships and interconnections. Who, if anyone, should be a part of the decision about this issue? Can you or should you meet and talk with the major stakeholders and hear their story in advance? Do you need to gather anybody else's perspective? Do you see any similarities emerging already? Is there any differences emerging already? Who should be involved in the ongoing discussion? your patient, the client, your resident, the family? Does human resources need to be there? Does your quality team need to be there? How about the privacy department or perhaps senior management? You need to understand who is going to be accountable for this decision and perhaps consider having them present. The second step is thinking about some of the ethical considerations. And if you reflect about Module 1 and Module 2, this is really an opportunity for you and your team of stakeholders to think about some guiding principles such as beneficence, maleficence, justice, autonomy. For example, some of the questions that you might want to consider here are, if this is a clinical issue, what does your client want? How can your client benefit by an intervention, and what harm are we trying to avoid? What is the history around this issue? What is the prognosis for the client? Is this issue, if it's a clinical one, an acute issue, a chronic issue, a new issue? Is the issue changed in some way? What, if any, are the probabilities of success? What if there's a failure? What impact will that have on this situation? You need to think about your client or your patient. Is your client mentally capable? Has he or she stated any preferences, either most recently or in the past? Has your client been informed of the benefits, the risks associated with this issue? What, if any, consent has been provided on this issue? Is the person's right to choose being fully respected to the fullest extent possible? And if not, why not? Are there family issues that are influencing this issue? Are there economic or financial factors that you need to consider? Are there religious, spiritual, or cultural considerations? And this is also an opportunity for you to think about, are there laws to consider? And is there any conflict of interest present? So these are some of the things that you're going to consider at step 2 when you think about ethical considerations. As you work through this framework, we really are obligated to consider such things as autonomy. Would we be exploiting others or treating them paternalistically or otherwise affecting them without their free and informed consent? Have any promises been made? And one of the examples I like to use here is frequently in a hospital setting, a physician may suggest to a family who are struggling with the stress of providing care for an aging family member that perhaps the family member needs to go into a personal care home. And so by the time social workers get into that interaction with the client and the family, they often have it in their mind that their loved one is already going to a personal care home. So it's important to understand what might have been promised, and I use that word loosely, in advance to going into working through an ethical issue. Non-maleficence. Will this harm our clients, the caregivers, or members of the general public? Beneficence. Is this an occasion to do good to others? Remember that we can do good by preventing or removing harms. Justice. Are we treating others fairly? Do we have fair procedures? Are we producing just outcomes? Are we respecting significant rights and entitlements? Fidelity. Are we being faithful to our institutional and professional roles? Are we living up to the trust relationships that we have with others? And this is also a key time for a social worker to reflect on Canadian Association of Social Workers Code of Ethics, and what does it say or have to say about the particular situation that you're working through. Does your professional standards of practice from your province guide you in any way? These are all things that you should be considering and thinking about. Choosing options is our next slide. It doesn't seem to want to come up. Oh, there it is. Choosing options. So take a moment at this point, the model suggests, to sit down and point out a list of risks and consequences. For each one, outline your possible harms or levels of risk. What kind of options are you thinking? What kind of options has the team come up with? Does this issue need to be dealt with now? What if you did nothing? How important is this issue? What could possibly go wrong? This is an opportunity for you and your stakeholders, whoever you've invited to the team, to really sit down and brainstorm. Think about realistic options that you could actually implement. I know sometimes when you have people together and you brainstorm solutions and ideas and options, they can get pretty far-fetched, but you really want to bring your team back at this point to think about what are some of the things you could actually do. There may be nuggets of information in those far-out creative ideas, and so you don't want to lose sight of those, but you want to pull those nuggets out and jot them down and think about some of the potential risks and consequences to those ideas. Ask yourself and your group, what are the possible approaches to address this issue? Is there anything that we can compromise on? So in previous modules, people have said, what should a social worker do if their interprofessional team doesn't agree with some of the ideas? And this is really where you want to have a bit of a discussion with your team about their ethics, their values, where are they coming from? And I can think about situations here in the hospital where perhaps maybe one of our occupational therapists might feel that a person's behavior puts them at risk or makes them quite vulnerable living in the community. However, from a social work perspective, what I've heard from the friends and family is that that client wishes to live independently in the community and are aware of the potential risks. So this is an opportunity to have a bit of that dialogue and move through some of those values, some of those challenges. Now it's an opportunity at this point to think about the deliberations and discussions that you've had. You really need to summarize the findings. So in your meeting that you've had with your team, your systems meeting, whether the family's there, whether the client is there, whether other stakeholders are there, you want to summarize the things that you're hearing and the suggestions that have come up and outline some of the main choices, approaches that you're hearing from the group. State it out loud. Not everyone is going to be in agreement, but can everyone live with the particular choice that seems to be coming out as being the predominant one? Does everyone understand the rationale for that particular choice? Does it sound reasonable? Not that I want people to worry about this in their practice on a regular basis, but when you're going through an ethical challenge like this, it does help to kind of ask yourself, does this pass the newspaper test? So if you were to put this in the newspaper, the media got a hold of it, would it be reasonable to most people? Another question to ask yourself at this point as you're working through that best choice and trying to figure out whether or not there's a couple of viable options that you might be able to implement, would another reasonable social worker make a similar decision? Those are some of the things that you can test. I found this ethical checklist that's on your screen right now, again at the Manitoba FEN website. It's from the 10-step method of decision-making and ethical checklist developed by Doug Wallace and John Peckle. I'm copying it here with reference to them, but this checklist can really help you be sure you've reviewed all your major ethical considerations. It's not intended to be kind of a scientific tool, but may provide you with some reassurance along the way that you've done some evaluation of issues. So back to kind of that newspaper test. The higher the total score, the more comfortable you may be with your decisions. If your gut is telling you that something that your checklist score is not, go back and address your questions that may have been raised. So this could be done with yourself and this could be done with your team. Even if you do not change your score on a particular question as a result, you will have thought through your choices more thoroughly and will be better able to describe the reasoning. And I think that that's a common statement that is coming out of using an ethical framework, is to really allow the person who's working through the ethical challenge, the ethical dilemma, an opportunity to reflect and then be able to describe their reasoning. So in this particular checklist, the relevant information has been found, the involvement, you've included everybody that you think needs to be included, the consequential test, the fairness test, the enduring values test, universality. So if I do this for this person, can I do it for others? And really just understanding whether or not all of the members are confident. So a score of 7 to 14 is that you're not very confident. A score of 15 to 21 is that you're somewhat confident. And a score anywhere between 22 and 28 suggests that you're quite confident with your recommendations. Anything higher than that, you're very confident. So the last step is really about implementation. You need to think about, now that you have had an opportunity to meet with your team and work through all of these steps and you've come up with a viable option, everybody is willing to put it into practice, may not be totally 100% comfortable with it, but everybody agrees that's the best thing that we can do at this time. You need to think about an action plan. What will you do? Who needs to be told? How are you going to communicate this choice? To whom does it need to be communicated to? What is the best way to share this information that came out of this meeting? Is it by email? Is it by letter? Is it another meeting that needs to be held? And who all needs to hear this decision? And that's really important, not only thinking about your client and their family and the stakeholders that might be impacted, but also if there's policy implications or human resource implications, you might want to consider giving that feedback to those people so that they can take that into consideration. And the last step that I find often goes unaddressed is evaluation. We often don't do it because it does take time, but it really is important to do some self-reflection at this stage. Thinking about the ethical dilemma that you've worked through, what have you learned? You as the social worker, what has your team learned? And again, going back to that concept about can it be shared? If it has policy implications, should something come out of that? Is there other people that might benefit from the learnings that you've learned by going through this model? So thinking of myself and my role here at the Winnipeg Regional Health Authority, trying to connect 7 hospitals and making sure that we have some consistency with our practices. If one particular site worked through a very challenging ethical issue and came up with a potential resolution, it's great for us to share that at our monthly Social Work Leadership Council so that each of us can kind of learn from what others have done. This is also an opportunity at this evaluation stage to think about, is there any moral distress or residue? Does it need to be followed up on? Evaluate the outcome is talking a little bit about thinking if it's a client situation, so thinking about the situation where I was suggesting where perhaps part of the team thinks an individual needs to be moved into a more safer environment. However, the client wishes to go home. If we were to discharge a client home with supports in place, is there a way to follow up with that client a month or so later to find out whether or not the plan, the recommendation that was put into place was successful, or to see if there was any intended outcome as planned? So just a reminder, it is possible that not everyone involved will agree on a chosen solution, but it's important that the relevant stakeholders can at least support the plan. This tool is supposed to help with and support that collaboration. Hopefully, by doing a tool like this, it can also help reduce some of that moral distress. So during your debrief, once an ethics event has occurred, it's really important to review the process and the outcome. The decision guide that I have up on the screen right now will help you debrief the event and evaluate what's occurred, the decision that was made, and the methods that were used. This process can help provide closure and learning for those involved in a difficult encounter or decision. Ethical problems can be complex and emotional. They evolve over time and often need multi-step resolutions that take place over a period of time. Once the immediate crisis has passed, it's easy to move on to the next thing without evaluating or debriefing. This can leave those involved with unresolved distress. Worse, it means important learning opportunities could be missed. While outcome is often a reasonable measure of how well an ethical situation was handled, it is also important to look back at the process. Identifying the challenges and what went well can provide additional closure for stakeholders. Evaluation will also inform process and methods the next time something or someone with ethical implications arises. We need to ensure those involved in an ethics discussion or issue have the opportunity to review and evaluate with a reasonable time frame after the event. A debriefing session can follow a format that is comfortable for the group. It may be helpful to have a facilitator guide the discussion, and some of the questions that you might want to think about are things like describing the situation, describing the resolution, describing the decision-making process, how do you feel at the end of the process, how did the family, patients, and others feel? Are you comfortable with the outcome? Are you confident that others are comfortable with the outcome? What have you learned? Did the process and outcome achieve the desired result? Was there any unforeseen consequences? Would you do something differently in a similar circumstance in the future? If so, why? Is there any moral distress or residue from the situation that needs to be considered or acted upon? How will you follow up on any outstanding issues? Were any broader policy issues raised during the discussion that warrant further investigation? And what will you do to escalate this issue if you need to? Moral distress is the pain or anguish affecting mind, body, and relationships in response to a situation which a person might have been aware of a moral problem, acknowledges moral responsibility, or makes a moral judgment about the correct action, but as a result of real or perceived constraints, participates in or allows the moral wrongdoing to occur. In other words, it's a situation where you know the right thing to do, but are sometimes prevented from doing it. Moral residue comes after moral distress. It is what remains when in the face of moral distress we have seriously compromised ourselves or allowed ourselves to be seriously compromised. These times are very painful because they threaten or sometimes betray deeply held, cherished beliefs and values. A crescendo effect occurs after repeated situations of moral distress. Each time, the level of moral residue rises. This can be because morally distressing problems tend to be similar over time. New situations remind providers of their powerlessness in past situations, and a crescendo builds. Eventually, a breaking point may occur where the individual must do something to address the problem. Realistically, I recognize that not all problems or not all situations can be resolved. However, negative effects of moral distress can sometimes be minimized by improving communication skills, regulating our emotional responses. Uncertainty can be reduced through education or on ethical principles and theories and systemic approaches to problem solving, such as the one that we're sharing with you today. Resources such as ethic committees and employee assistance programs can also be helpful in these situations. So in summary, ethical decision-making in any given situation will involve the informed judgment of the social worker. Even though we have a code of ethics, conflicts with our clients, our agencies, or communities need to be dealt with in a manner that is consistent with the CSW Code of Ethics. Social workers need to know themselves, they need to know their values, but we also need to be aware of both the spirit and the letter of the code and how it will impact our practice. And those are my thoughts for the day, Fred.
Perfect. Thank you very much, Vicki. As always, hugely appreciate you taking the time to do this. Then it's the end. This is our third of a third-part series, and for those of you that are listening to this is the time we move into the Q&A section. So if you have any questions for Vicki based on presentation today or based on the first two presentations that she did, please type them in now, and I'll try to get to them all. Thank you very much for presenting the four-step framework to us. I was wondering, as you were talking, if there's there's a question of where, just if you can repeat where the four-step framework came from that you are speaking about today. And then a second to that is, if my workplace does not have an ethical framework or process put into place, how would you suggest that I move to get one implemented?
Yeah, great questions. So this particular framework came from the Manitoba Provincial Health Ethics Network, and I do believe in one of my slides the the link to that was there. If not, we'll make sure to get that up. They have lots of different resources and frameworks on their website. And the whole purpose of that website is to really encourage people to go to their tools, print them off, and bring them back to their agencies, to their communities, to wherever they might work, to be able to have a dialogue. And so I guess that would be the second part of my answer would be, if you don't already have an ethics committee or don't already have an ethics process, this might be an opportunity to bring that to your supervisor or to your organization in whatever framework. I don't know if you have staff meetings or monthly meetings of some sort, and just talk about the value of having a bit of an ethical process in place. We recently, well, I wouldn't say recently, but over the last 5 years, I'd say here, even just at the Grace Hospital in Winnipeg, we have really sat down as an ethics committee and talked a little bit about what would be our model and what is our role and what are we trying to do. And there was an ethical situation that came up last year that caused quite a bit of moral distress in the team. And so we used this process that I'm sharing with you today to sit down with some of the team members and to talk about some of the concerns that they had and some of the impact that some of the decisions had on them, and try to work through this process with them so that we could come up with a solution or an option that people would and could feel better with.
Perfect. Thank you.
Take some time.
Just for a few people that are asking, yes, the slides and the presentation will be available on the CSW website shortly after today's presentation. I have someone asking, and I'm going to put them together here. Can you give me examples of work a problem, so an ethical problem through the framework? And then someone else asking, can you review the scoring for the confidence test for decision making? So I kind of wrap those two together, and I'll let you go from there, Vicki.
Okay. Well, the easy one for the checklist, let's go back to that and talk about the scoring. So you can see on the checklist here, the suggestion is that there's a 1 to 5, depending on kind of how comfortable you feel. So 1 is not at all, and 5 is completely yes. So if you're reading through the test and you score it, 1 being, no, I don't feel good at all about this, or 5, I feel very good about this area. So it would be from a 1 to 5. If at the end you tallied up 7 to 14 points, that would reflect and suggest that you aren't feeling very confident. 15 to 21 would suggest that you are feeling somewhat confident. 22 to 28 would suggest you're quite confident. And 29 to 35 would say you are very confident, so probably mostly your 5s. Your gut is telling you that you're doing pretty good here and you're feeling pretty comfortable with the decision. Now that I've answered that, of course, Fred, I've forgotten the first part of that question.
Actually, and I deleted it as we go, so I'll ask another one and I'll go back to it. Sorry. Anybody else remember? Nope. Okay. So in my observation, often social workers feel more accountable to or enforce more strictly around confidentiality and dual relationships, for example, and less so with social justice issues. How do we move toward greater accountability for social justice?
Okay, well, I've written that question down, but I'm actually going to go back to, I forgot what the first one was, but I've remembered it now. Somebody was suggesting an example of going through. Yes,
you're right, working through a case example through the model, through the framework.
Mm-hmm.
Yeah.
So I can share with you that an example was the one here at our hospital that caused quite a bit of moral distress for the team. A woman had to come to the hospital for an acute issue, and although it may seem simple, she had to leave behind her belongings, including her animals. And the solution originally from the hospital was she was not willing to participate in any of the medical recommendations, and I believe one would have been for surgery, her whole focus at that time was on getting back to her belongings where she had left them in a temporary kind of place along with her animals and wanting to resolve the issues around her animals. And I'm not exactly sure how it resulted in this, but the conclusion was the hospital, the team, found this woman incompetent and therefore was looking to the public guardian and trustee to make decisions specifically around enforcing some emergency surgery options on this particular client. And the team was quite uncomfortable with that solution. And so we moved through after the fact. I mean, there was a more urgent response in the sense that we worked through the issue very quickly so that we could sort out whether or not this person was in fact incompetent or whether or not this person was making some perhaps poor choices or choices that didn't reflect the recommendation. So we worked through that quite quickly and were able to resolve her being allowed to sort out a plan for her animals and her belongings with the support of the social workers, a temporary solution that was better than the solution she had left them in, which allowed her some comfort and ability to then focus on her health needs. However, we did go back with the team and work through this entire model after the fact, even though we came up with an urgent solution, because the team wanted to make sure that, to use the question that just came up, the team wanted to make sure that there was a more accountable process in place in the future should something like this come up, so that we aren't just defaulting to finding somebody incompetent when they are potentially making decisions that we're not comfortable with. So it resulted in a very good conversation in this particular hospital, and hopefully as a result of that, we've come up with a bit of a process around how do we assess people's competencies and what steps can be need to be taken before we even go to that level of an intervention. So the second question that the person asked was, how do we be more accountable? How are social workers more accountable? How can they, we're very comfortable perhaps being accountable around issues of confidentiality, maybe less so around things like social justice. And really, one of the practices that people need to think of, and if you go to the Manitoba FEN website, they do have like little tools that are called the Ethical Decision-Making Framework Memory Jogger. And so I can only speak from my experience, but what I've done since really working through some of this over the last year is I actually have that as a tool right in front of me at my desk. So when I'm making decisions or when I'm consulting with my staff or they're consulting with me, I really try to take a moment to reflect on this and take a look at this little memory jogger to say to myself, am I just making a decision based on past practice, or do I need to step back just for a second and take a look at some of these things, clarifying the problem, thinking about any kind of ethical considerations, and choosing options, making sure that I go through some of those things, the solutions, and then thinking about a way that needs to be implemented or evaluated. So just making sure that we have a tool present. And it doesn't have to be this one, but before you jump in and make decisions quickly, you really need to just step back sometimes for 5 minutes and think about, how did I come to that decision? Am I being ethically accountable?
Sage words. I find that even when I'm writing emails, it may not be an ethical thing, but just taking a step back and reflecting on what you're, why you're doing it. It's very good. If you have any memory jogger tools that you have, I wouldn't mind hearing those, and I'm sure people in the audience wouldn't either. So the next question we have here is, the right to self-determination is often a point of contention at interdisciplinary meetings. Have you found that the right to self-determination doesn't seem to be a priority with other disciplines? If so, why do you think it is unique to social work?
Yeah, it is interesting that, in my research and even just trying to get ready for these modules, the research really speaks a lot about how social workers for lack of a better word right this minute, stand up for self-determination and really want to encourage and support people and helping them make informed decisions. And it seems to be a key value of the social work practice. I'd hesitate to say that it isn't part of other disciplines practice. I'm sure that it is, but I think it's a stronger background. It's part of who we are. It's part of what social workers, where we've come from, our roots. It's just part of our history, and it's just really a big issue in our values and our ethics. So I do see that we often are the ones that, when there's conflict around people, to go back to the example I used, making patients or clients making decisions, if those decisions are considered poor decisions, my experience in some of the healthcare settings has been to react and try to be a bit more risk adverse. Whereas I think social workers are really trained to think about how do you support the client and where the client's coming from. So it is a bit of a challenge in a healthcare setting, I'm sure in other settings as well, to be able to work through those different conflicting values, and maybe not always conflicting, but maybe a little bit of headbutting around those values with your fellow interprofessional team. So this model that I discussed today doesn't have to be done, it doesn't have to take hours and hours to do, but even just taking a moment to reflect on the fact that your colleague seems to be coming at something from a different angle. It behooves us, I think, to ask about that and to talk about that and to say, it sounds to me like you're not comfortable with this decision that the client is making. I feel very strongly that I need to support her self-determination. Can you tell me what's bothering you? Let's talk about this. And even just to work through the model on a one-to-one basis sometimes, sitting down and having that little tool in front of you can help you guys have a discussion that is perhaps more objective than subjective, because it gives a little bit of that objectivity to it by using a bit of a tool.
I think this question, is along the same lines, but I think we'll give you an opportunity to answer it a little differently. How do you help the different hospitals? So I think this is specific to your experience. How do you help the different hospitals to follow the same rules? I find that this is an area where an agency who has offices in many locations and they work differently. This is frustrating, especially when family transfers, like in a region where a family has new rules, moves into another room, has new rules. So I guess the question is, in a health authority that you're in, probably within differing hospitals, how do you try to get them to follow the same rules?
Well, that is an issue. I mean, I used to work in child welfare many years ago, and we had different agencies in the community, and so, invariably somebody would perhaps have involvement with child welfare in downtown, and then they would move to the north end, and perhaps different perspectives or different approaches would come up. So the same thing happens naturally in healthcare. I think, what I try to do is, I have relationships with all of the social work departments as well as whoever they might report to in the hospitals in the region, and we meet monthly. We try very hard to carve out that time to meet as social workers on a month-by-month basis, and we have what's called a social work leadership council, and we bring some of those issues to the table. So if one particular hospital is struggling with how to implement and enact things like a charge to clients who may not choose their first available bed, which is a highly challenging and ethical dilemma for us, she or he might email me about what is the process, what are other sites doing, and we might have an email dialogue amongst ourselves about what we're doing. But if it's a really challenging issue such as that, then I would probably encourage us to take that offline, off the email exchange, and have a bit of a discussion about that in our Social Work Leadership Council meetings. And that's also a time for us to invite people like the director from the long-term care setting or whoever it might be, so that we can come up with some guidelines, some best practices do a little bit of research, and maybe develop a bit of a tool that we agree to and put on our social work policy page.
Excellent. This one's going to come at you from a differing angle. So are there general directions that social workers can use to decide if a client's self-determination should be restricted?
I don't know of any particular tool that we have for that. I think those are difficult decisions to be in, and we really need to talk as a team about why we would want to do that. So I think we should always be starting from the standpoint that we wouldn't do that. And so in these situations, why should we do that, and where is this coming from? And it's through that dialogue with the team and finding out what are the risks, what are the consequences, which values are coming into play. All of those things, much like the model kind of suggests, you might be able to sort out whether or not in this particular situation a person's right to self-determination needs to be confined in some way. But there's no easy answers to that. There's no scientific tool that I'm aware of, and each case would have to be very different because people are very different, right?
Yeah, very true. Very true. In your framework, there's listed a number of different ethical theories. Could you elaborate on those that are most relevant to social work practice?
I think in the 3 modules that we've talked about here, I've kind of thrown out some different examples of different theories. There is no, again, one theory that encapsulates everything that is specific to social work practice. I think all of us need to think about where we come from and what speaks to us the most, which ethical background feels most comfortable to us. Some of the pieces of material that I've chosen to focus on over the last 3 modules are really coming from that bioethics, coming from healthcare, just because I work in healthcare. But I think in module 2, I talked a little bit about, consequentialism. I talked about deontology, talked about cultural relativism. I think when in the first module, when we talk about the self-awareness, pre-tool that we kind of shared with people, just being able to sit down and think for yourself kind of what are the values that come most to you and how would you rank them. It would be a good opportunity to then also think about what feels best to me. Is it cultural relativism that I feel comfortable with? Is it deontology? Is it consequentialism? What else might be out there? You can do a little bit of research or Google search to find out some of the other models that might be out there. But which one kind of sits best with me? It doesn't mean that you will always operate from that, but it's probably a good way of getting to know yourself and understanding where some of your values lay.
Okay. I think this one is more specific to Manitoba, which I think is perfectly fine. It has, I think, aspects of it that can be understood across Canada. So it says in child welfare in 2013, I'm assuming in Manitoba, the duty to report changed from imminent risk to reporting all concerns without advising client if the concern relates to them. So the example is given, so if a family comes to see a social worker to discuss struggles with family, they share that they cope by smoking marijuana. Some social workers believe they have to report it, or if in the case of a teen, they was with pushing involvement, I think. Some think you have to report it. So I guess the overlying theme are instances where there might be some legal cases, and it has changed. It's mandatory to report all things. Where do you kind of find that line? And asks for your thoughts there.
Yes, child welfare is, I think we talked about this in the beginning, the first module, just if people can remember the module where we talked about black and white and then the gray, I would say, child welfare has a lot of gray in it because There's a lot of different things that impact whether or not a child is in need of protection. What I usually encourage people to do is I use this book called The Reporting of Child Protection and Child Abuse. It's a handbook and protocols for Manitoba service providers, a resource for those involved in identifying, reporting, and dealing with a child in need of protection, including child abuse, and it was developed in August 2013. It can be found on the Provincial Advisory Council on Child Abuse on their website, and it's a really handy tool. Again, it doesn't give you the answers, but I find in Chapter 4 when it talks about kind of the legal definitions of when a child or an illustrations of child in need of protection, this is one of those pieces of information that I would bring out when one of my staff might come and talk to me about, do I need to report this? Is this reportable? It really is, when we talk about a model and working through a model, when you think about what values or what ethics might be in step 2, kind of describing the ethical considerations, this is also a time to think about, is there any legislation, is there any other things that are impacting or would suggest what you're supposed to be doing. So I really find it helpful to pull this out each and every time and take a look at it and go through it. So if we talk about the very first example, for example, is a child is in need of protection when she or he is without adequate care, supervision, or control. So depending on what the example might be, my staff and I would kind of walk through that. Is that particular client, is that child, do we have information that suggests that he or she is without adequate care, supervision, or control? And if we feel like we do, then we need to report. So we kind of use this as a bit of a guide to try to help us have that debate and talk through it. So I don't know if that helps or not. I think this question's
fairly similar. What are the legal expectations for social workers sometimes encounter when individuals or society's expectations conflict with their social justice principles? I.e., if a client did some babysitting that exceeded their limit for social assistance, but they need food that month.
Yeah, I think you're right, Fred. It is very similar. So we need to go back and take a look at what pieces of legislation might be influencing or suggesting how we make a decision. We need to look through this model or another model to take a look at, what are the ethics in the situation, what are the values, whose values, and kind of sort through it. And again, this model can be a whole systems meeting where you're going to sit down with a lot of stakeholders, or it can be something that you might use in supervision with your supervisor or with a colleague. Can you help me just work through this, whether or not I should report or have to report? And just pulling all of that material together and just taking half an hour or whatever it might be to really kind of objectify some of the decisions that you're making and why you're making them.
Excellent. If you have a question, we're almost through all the questions that I have, about 3 or 4 are left. We have about 5 minutes left, and so if you have a burning question, type it in. I may or may not be able to get to it, but we're getting close to time, and I have a few more left here. But this one is from me because it's something we deal with on the national level quite often, is liability. And we offer a national liability program through BMS group here on the national level, but liability is always close, and I always I get the opportunity to field some questions from social workers on ethics and on liability. But when it comes to ethics, I'd like to get your perspective, because the words liability haven't really came into the dialogue in the 3 sessions that we've had. So your perspectives on liability of not reporting or on reporting, and what is your professional, advice in the sense of limiting your liability as a social worker?
Well, I do a presentation every 6 weeks or so to the emergency room nurses on child protection, on abuse and neglect. And part of my responsibility as the Regional Director of Social Work for the WRHA is managing compliance with our policy that's titled abuse and neglect of adults and children in need of protection. So we're talking about adults that might fall under the Vulnerable Persons Act, we're talking about Child Protection Act, we're talking about all of those things. And I mean, there's no easy answer, and every case can have some gray area, but my general rule is that we don't know everything that is going on. We're only seeing what's in front of us. And if we have a reasonable suspicion that somebody is being abused and neglected, and there's a legislative act that mandates our reporting, then it's our responsibility to make that report. I think most legislation, from my understanding and my perspective, would supports us to make a complaint in good faith based on the information that we had in front of us, and protects us from any wrongdoing if we do make that report and it turns out to be false. Most legislation has a piece of some kind of comment in there that if you don't make a referral, then you can be fined or held liable. So I really encourage people, if you take Child and Family, for example, it could mean nothing, and if it's nothing, then Child and Family Services will do their investigation. They'll provide support to the family and hopefully close the file. But it could be everything, and it could make the difference. And I think when you look at some of the inquests and some of the information that has come out from some of the inquests, often the issue has been, or at least in the experiences that I've had and reviewed, is that the information wasn't shared. And if that information was shared, could it have made a difference? Maybe. So I would recommend that people be aware of the legislation that guides their practice, and understand what their policies and procedures are within their organization. Maybe you do need to have a consult with your privacy officer. Maybe you need to have a consult with your legal before you make a report. I'm not sure. But generally speaking, we are encouraged to do our mandated reporting according to the legislation. Does that help? Does that sound right, Fred?
Yeah, very much so. And here's a good question in terms of private practice. The question is basically, I don't have opportunity to consult often with others in my private practice. Is there a framework or a tool that you might be able to refer this person to outside of this 4-point framework?
Yeah. I think that, this 4-point model could be something that a person in private practice can use to guide their own decision making. It really is about helping you be more conscious or more objective in making decisions. And I think that's what we've talked about in Module 1 and Module 2, is oftentimes our values are unconsciously guiding our behaviors. And so by using any model, and this is just the one that I feel the most comfortable with because we use it here in our organization, but really using any model helps you be much more objective, and helps you explain some of your decisions. So sitting at your desk and just working through a situation by using this model all on your own is, I would recommend.
Perfect. Thank you very much, Vicki, and thank everyone for joining us today. I've got to most of the questions. There's a couple left here, but time is up, and so I'm sorry that I didn't get to them. For those of you, there's a couple questions here about getting the certificate. For those of you who have attended, and the ones previously, outside of the first one, because I missed this tool, adding this tool to the first webinar. But for those of you that attended for 45 minutes or more, I was under the impression earlier, and my apologies, that an email would be sent to you directly if you attended 45 minutes or more. I have been corrected, and it is this easy. Once you finish today's presentation and you hang up and head off, what will happen is if you can log back into that same link that was provided for you to access the webinar, you can log in with your same name, and if you've attended for 45 minutes or longer, there will be a little yellow square, so a little yellow button. If you hover over top of it, it'll say certificate. You click that, and you can download your certificate that will note that you have been there and attended for 45 minutes or longer of this presentation. There's other questions on will the first and second webinars in this series be accessible? Of course. Most certainly, if you go to our website, csw-acts.ca, that's www.csw-acts.ca, and just click or hover over Continuing Education and hit Webinars. It will lead you all the way to all the webinars that we have archived, the 10 that we are delivering this month in celebration to National Social Work Month, and the ones that we've delivered in previous years. And again, if you have previously not completed a short survey, please complete the short survey on your way out today. It really will help us inform the future continuing education offerings at CSW. And finally, on behalf of the board of CSW, as well as the Manitoba College of Social Workers, I cannot thank Vicki enough for lending her time and experience to developing, presenting, and delivering a three-part series of ethics this year. It's truly added to the value of National Social Work Month for all social workers across Canada. It will be archived on our website for future reference. And again, thank you all for attending. And Vicki, thank you very much for presenting.
Thank you.